Hi everyone. Today, our last episode of Digital Health Vitals of 2025. We are going to discuss some great news happening in digital health, but also we're going to pick some winners and losers of 2025 and maybe even have some predictions for 2026. So stick around. Please like, subscribe to our channel. We really hope that going to reach that 1,000 subscribers by the end of the year. And Sergei promised not to come back to the US from Lithuania if we don't reach 1,000. So please subscribe. We really want to see him at some point again. Today, we have Sergei Polevikov, my co-host. Hi, Sergei. And also Rick Renard. Hi, Rick. Ben got too busy with holiday preparations, so he is gonna skip this one, but we are hoping and waiting for him to come back in the next episode. So yeah, let's get straight to the news. The first one we have for today is OpenEvidence set to reach 12 billion valuation. And there's a lot of things happening in this OpenEvidence Doximity saga. So Sergey, I'll let you kick things off and tell us more about what's happening in the space.
Yeah, so OpenEvidence and Doximity, they've been in this legal fight. First, just to briefly kind of summarize OpenEvidence, we're saying that Doximity was using was trying to get to the bottom of their proprietary AI models, which is not really models, but it's kind of like a RAG system, but essentially AI system through various smart prompts. Actually, as the legal battle started, Doximity actually acquired another firm that OpenEvidence was suing almost for the same thing, which is kind of funny. Doximity denies that. Then, there are a bunch of really comical things going on, like the founder of OpenEvidence started openly reaching out to employees of Doximity in the middle of a lawsuit. Basically, I guess, trying to get them on OpenEvidence side. I mean, the story behind it is actually that the core sales team of OpenEvidence is actually a former Doximity team. So there's some weird connection going on. So a lot of things I probably don't know. Maybe Rick has more color. So that's the legal battle. The valuation and fundraising, to me, it's been completely ridiculous. It's shouldn't be happening this day and age. I feel like if it was a public company, things would have been different. But this numbers that are very, very questionable of their ARR that all of a sudden jumped 3 times or 4 months. I don't know. They got some big contracts, whatever. Highly doubt it. I think when you're private, you can say some things. In terms of numbers, and it's a little blurry. Are you talking about like this year's numbers? Are you talking performer numbers? Are you talking about that you grow like crazy and that's where you're gonna be next year? It's like when I read this, to me it's all mixed up. I'm very confused. And when I'm confused, it means that something is not right. So again, 150 million ARR from 50 million, that wasn't even true back in July, tells me something going on. And the valuation, even with that 150, is one of the highest in the whole AI industry. Seems very, no matter what they do, and they do some good things, but in terms of like pure venture capital play, I have a lot of questions. I have a lot of suspicions. Numbers make zero sense to me. I wish they were more straightforward. I wish they were at least given some guidance instead of just saying, oh, we all of a sudden we grew. Guess what? We're there now. Give us more money. Give us 20 billion valuation. So they're bigger than Doximity with 12, if 20 billion valuation is gonna be true. Doximity, by the way, they have 40% net margin, not gross margin that OpenEvidence, Daniel, the founder, talks about all the time. They actually have real money. They don't need any VC, by the way, because they're public company. They've been doing well, and so being valued at higher than Doximity is like makes absolute zero sense to me. I'm gonna stop talking and let Rick give some color on that.
To me, there are a few interesting points there. So the first point is that if they manage to get to 12 billion valuation, according to LinkedIn, they only have 90 employees. So like if you look at like the percentage worth per employee, that in itself is already very interesting data. And then to Sergei's point, like the entire sales team, for example, their VP of client partnership worked at Doximity for almost 4 years. The SVP of commercial worked at Doximity for almost 8 years. The VP of client partnerships worked at Doximity for almost 8 years. So it's like they're just stealing all the key people from Doximity and then like replaying their entire playbook, which is interesting. All that to say, like if they are actually getting to that 150 million ARR, if they are getting to that 90% gross margin, and if indeed like the vast majority of US physicians are using them according to that off-call survey that they also mentioned in some press releases, like kudos to them because they managed to get to all that growth and all that valuation without like an extremely bloated team, and also without any EHR partnerships, which I think is also very interesting because like we always think like you need deep epic integrations to become like a very profitable and valued company, but in their case they're not focused on that at all per my knowledge. And the last point that I also like am seeing is like, to me, the logical next step for like the ambiances and the bridges of the world is to go exactly where OpenEvidence is also at. And that's where we will see like who's going to win. Will it be the one with the DPHR integrations, which means that you can pull information from the patient chart and become an OpenEvidence on steroids because you can also pull data from the patient and you can be more specific? Or is it actually OpenEvidence that will win because they have a better product, because they have better marketing? I don't know. But also like from an OpenEvidence perspective, all the revenue I think is coming from revenue from ads. So like at one point will physicians say like, dude, I'm so done with all of these ads from all of these medications that I don't want to prescribe. Let me just use Ambience or a bridge that has a product that is like as good and also takes into account the patient history. So it will be very interesting. Will it be like the EHR mode that will win? Will it be the brand? Will it be something else? I have no idea, but like I wouldn't bet against OpenEvidence. I think they're doing some cool stuff as well.
Yeah, the idea is great. Obviously, like this is actually something I've been involved in to essentially have great data, to have research sources, to help patients, to help doctors. I mean, there's no argument there. I'm arguing about the numbers. You're saying it's all ads. It's like, oh, all right, so we have now 3 times more ads than in July. You know, it's like, okay, you know. By the way, it's only the management who claims all these numbers. I have not heard from anybody, and I've talked to a whole bunch of people on both Doximity and OpenEvidence side. Nobody knows where the numbers are coming from. So I don't know what Daniel is doing there, you know, what his CFO is doing. I wish they had more transparency because, you know, to have their VC friends just based on that one number and then the valuation is just skyrockets, which is, by the way, still, even if that number is true, which just hard to imagine, like it just like mathematically just makes absolutely no sense. It's just, how can you claim that? How can you think that the rest of the industry is so dumb that they cannot even question the number? I cannot be, but even that number, they have 80 what is it, with 20 bill valuation, had 80 times revenue, which becomes all of a sudden one of the most expensive companies anyway. So I don't know, it's a strange story, you know, fun to talk about, a lot of uncertainty. I wish they were more transparent, at least give us some data points instead of just saying our ad revenues, you know, went up all of a sudden out of the blue. You know, I guess it was a good year for ads. I don't know.
Well, let's see what 2026 is going to bring us with all this saga. It's going to be interesting to follow this news, and I'm sure we're going to talk more about both of these companies next year. But let's move on to the next news, and then I want to talk about a new study came from Stanford and Harvard, analyzed 149 selected eConsult cases across 31 LLMs, and reported that severe harm occurs in 22% of cases, with harms of omission accounting for 77% of all errors. So what does this study tell us? Are modern LLMs not ready for healthcare, basically, or what do you guys think?
Yeah, I think, yeah, basically it raises a lot of questions because it's the same team that I criticized earlier this year for their completely outrageous claim in the very, very small sample that they seem to be cherry picked. Still don't know how, where the peer reviewers are looking at. I've been peer reviewer for many years. It just wouldn't get through my desk like ever. Just like it's like statistics 101. This paper is a little bit better, but and then they're not even questioning. So in the previous one they're saying, oh yeah, it's so good. It was only one model. Here they tested 31, so it's a little bit different setup, a little bit different premise. But still, if you like literally look at this two Stanford studies, exactly same teams. In the second one, they added Harvard researchers as well. I mean, to me, asking different questions, but still, it's a bit kind of like weird. Here, you're saying that AI is so great. Here, you're saying, oh, maybe if you look a little bit deeper, it's actually the opposite. So it's raising a lot of questions. The setup is very questionable. Like statistically, I think they could have done a better job. But yeah, if you take it at face value, AI is making a lot of errors. It's eConsult database, which is basically, they track 20 specialties at Stanford Health and kind of document. There's a lot of missing data. That's why they're claiming they did this cleaning and picking the ones that have basically the most information in those cases. So they went from like 16,000 eventually to 149 to 100, which is another kind of big question. Like, couldn't get from the paper how they actually did it. But yeah, I mean, my takeaway that you have to be very careful with any claims these days. Any research seems to be published these days in healthcare, very dangerous because it invites more research like that, and we're gonna be in this vicious loop forever. So yeah, but if you believe at face value, basically yes, we have to be careful, and AI models are not completely ready. So I think it's always gonna be human in the loop, but in this case, it's even like a lot of questions whether we should use AI models at all, like for some of the functions.
And I think we already discussed it, I think, at the previous episode that we recorded, but I think the point that I strongly believe in is like for healthcare specific, especially clinician focused, like, for example, we use a lot of voice AI, and whenever we reach out to patients that is like non-clinical, it's more like administrative, like, hey, can you join for your appointment? Do you want to reschedule? Like all of these things, we use state-of-the-art models like OpenAI, Claude, Gemini. Like for those things, they are extremely well. I think once we get into the more of the clinical use cases, you need to, and also the coding use cases, you just need to work with smaller models or open source models that are like fine-tuned and trained on your specific use case. And so SORT, I'm not sure if you saw it, but like they also published a study, sorry, Sergei, around like Mind Eval. And essentially what they try to do is like evaluate how those state-of-the-art models do in AI therapy, which is obviously a very discussed topic as well. Some people are for it, some people are against it. But like case in point is the output or the conclusion of the study was also like, we shouldn't be using state-of-the-art, off-the-shelf models for mental health at all, and we should work towards more of like a trained approach. Another study that is not published yet, but that a company that I know well is working on, is like they looked into using AI to triage specific patient requests. So like, okay, you have those symptoms. Do you need to do self-care? Do you need to go to the primary care physician, or do you need to go to the emergency? And like AI was so much more doing over triage than like if you would just follow deterministic logical from like a clinician. So all this to say, like, I don't think off-the-shelf models are ready for clinical use cases. And that's why Ambience, for example, is partnering with OpenAI on fine-tuning their models specifically on ICD-10 encoding. That's why we see more of these companies like Heidi Health, like Scribing in itself. They're all working with smaller models that are like more fine-tuned to their specific use cases. So clinically, I think that's the only option going forward, to be honest.
And also, I believe we talked about open evidence, but anybody in that space that, I don't know, just my personal view that if you sort of combine, basically use as much data as possible. So like open evidence has a lot of very specific data that no one else has, right? So this is, in my view, their edge. They're already in position to basically go into any of these areas, triage, maybe even some kind of advice. Obviously, it has to be monitored by human at this point, but very well positioned. Combining research with actual patient history from EHR system, for example. I mean, that's like, to me, it's such a gold mine that sound this company already kind of halfway there almost. But we'll see what happens.
All right, let's move to the next one, CMS new access model. So are we actually going to get value-based care? Everybody was waiting for this for a long time. Sergei, tell us more what the new model is. And I wish, of course, Ben would be here and could share more about his insights, but he wrote a post about that. And Sergei, I'm sure you can jump in as well.
Yeah, again, I wish Ben was here because he wrote a lot about it. He's in the middle of it. He's an MD. I think he really welcomes something like that. So CMS actually came up with two different suggestions. So there's this so-called access model, and there was another one called MAHA Elevate. Make America Healthy Again, Elevate. So the difference is that access is basically it's the actual implementation of the of how the things like chronic care will be handled if you are part of this model. So they're trying to get a predictable recurrent amount of chronic care and tie the payment to the actual outcomes, right? So, I mean, we've been talking about this for decades, so this is just yet another model. So the details is still unclear, but basically the bottom line is that the payment to providers will be tied to the outcomes, right? And then, for example, if a digital health company or health tech company wants to work with that provider, that's also going to be part of the model. So they're hoping that technology essentially will help get better outcomes for patients. So again, moving from fee-based medicine to outcome-aligned medicine. So that's kind of the idea. As I was reading Ben's and others' comments, they were saying, it's a great model in general. There's still a lot of fuzziness. The details still unclear. How this is going to be implemented, how how exactly payments going to be made. So I think that was sort of Ben's point. So he says if it's implemented right, he says, I'm just reading his post now. It's going to be manna for digital health companies, and also validation for health tech that have longed for tech-enabled VBC world that didn't broadly exist. So again, kind of optimism, but kind of very cautious optimism on some expert side. Just quickly on the other model, Elevate. So that's basically kind of similar, but instead of actual kind of a payment model, they're saying, we're gonna actually experiment, sort of like a VC kind of world. We're gonna experiment. We're gonna create so-called partners. That's kind of another question, how they're gonna select those. We're gonna give you $1 million per year for 3 years, which is basically 3 years, and you experiment with different models, sort of outcome value-based models, and then you kind of report to us, what works, what doesn't work. So supposedly, if they do it right, there are already obviously companies, tech-based companies who are working on this problem. So if they're selected and given some incentives, that's kind of the idea that we're going to sort of select maybe validate, maybe calibrate some models and come up with a better solution for value-based care. So this is kind of the bottom line. My personal opinion is that, again, I kind of agree with Ben that it's great on paper, but you have to be careful how it's implemented. I think he said something along the lines that bureaucrats always sort of make it worse than the original idea. I don't want to repeat previous mistakes when I was writing a lot about companies like Babylon, and they had kind of similar idea, not exactly like that, but they convinced CMS to give them $1 billion check for value-based care. Essentially, it's called capitated model, which basically says, hey, here's some money. If you're really good, you will use the money, and if something left, you basically use it toward your business. But the problem, of course, was that all these companies are venture capital based, and nobody cares about money anyway. So they spend it all, and 15 months later, they announce bankruptcy. So that's kind of like the outlier, obviously. Well, hopefully. So I hope this is going to be a different story. So again, great idea, implementation. We're going to have to see.
From my point of view, it's the first time that as a European that has the benefit of free healthcare is actually jealous of what's happening in the US. You're right that the devil is in the details on like what it will actually mean. For example, what would the PCP get to manage all of these solutions? What will be the payment structure? How will it be paid? What happens if they meet specific thresholds? Like, because it's outcome based, so whenever they meet, for example, their blood pressure is under control, what does that mean for next year? Like a lot of questions, but in general, I think the signal that CMS sends to the industry is like, look, we are yet again in business for innovating and doing things that are different. And we suddenly give care providers, if it's profitable businesses, if it's startups, like a possibility to sell to a massive Medicare population in a way that is actually very compelling and interesting. And so you don't need to go through like insanely painful sales cycles anymore to get into, for example, an MA population. It's like, no, if you want, you can even do direct marketing and target our Medicare patients and just make sure that they get treated for the things that they need to get treated for. So I'm very bullish, and I also understand the skepticism, and indeed we need to hear more, but like this team at CMS is doing some very, very cool things. And I don't like, if this would happen in Europe, it would be like 7 years of discussions, and then they would do like a small pilot with a lot of regulations and a lot of guardrails, and it will eventually end up with nothing. And America is like, heck no, we're just gonna do things, and actually they're doing some very cool stuff.
The thing I like about if it's implemented the way they're planning is the fact that under access model, all information, the outcome based data is going to be public. So which tells me that what I know about the venture capital world, to me, it's like think Babylon, right? So I kind of think they wouldn't want that, so they may be actually talking to CMS saying, maybe we shouldn't make it public. But if it's really public and people are going to find out which model, which company is actually doing some efficient job in creating outcomes for their patients, would be so great to know. I mean, transparency is such a great thing. So if this is really going to be like they're saying initially, oh my God, this is going to be so interesting to watch.
A lot of people will also shit the bed and like be like, fuck, like.
Yeah, most of them, I'm telling you.
To your point, I do think there are many companies that are like, we will not participate because like we have been bullshitting the industry for so many years, and we are able to bullshit a lot of VCs by cherry picking data and cherry picking patients. And you cannot do that. And also I think they were talking in a podcast that I was listening to, like they will also put guardrails in place where essentially you cannot put or like cherry pick specific patients. So like you can only target patients that are not already in clinical targets. So again, for blood pressure under control, let's say it's like 120/80, you can only work with patients that have significantly higher blood pressure. So it's not like, okay, we are only going to target perfect, healthy patients, and because you want to sell to them, it's like, no, that's not even allowed. You need to work with the hard population, and then you need to show that you actually deliver clinical value. And so it will be so beautiful to start benchmarking that data, and it will also allow commercial partners, so like payers, employers, to just say like, okay, we want to do something within our commercial population. Let's just look at the data that CMS published and compare the data between competitor 1 and competitor 2, which is again beautiful, because right now in the space there is so much marketing bullshit and so much changing reality to win deals, and you cannot do that once you get involved in access. I hope, and I think they have a clear commitment for that. So I'm very bullish on CMS and the models that they put out.
We all hope. Let's see how execution goes. Let's move on. Our last news for today: Trump's new executive order on AI. So basically, the question is, taking away power from states would benefit, and we're specifically talking about healthcare or not. Sergei, you wrote a piece on this. Tell us what you think.
Yeah, I mean, I don't pretend like I know like everything is there. There's some good arguments for and against. But to me, the vibe is that similar to 2009 when we had the High Tech Act, and only the biggest HR players like Epic were happy, and kind of what is it now? 16 years later, we know why. So it feels a little bit like that. Like all the biggest players, OpenAI, Microsoft, Meta, all the AI players, they're cheering this basically saying, we have this mess, over 1,000 rules and regulations at a state level, local level. So why not have one rule? Which sounds great, but I just feel that if it's like anything like 2009, it's just gonna be kind of a subsidy for incumbents like large companies like Microsoft, OpenAI, Google, and probably gonna create additional barriers for smaller startups. So what Trump claims as a free market choice, and taking all these barriers from breaking all these barriers that the state created. I don't know. I don't believe that's completely true. I think it actually may create more problems. But yeah, on paper sounds great. Why not just have one regulation instead of 1,000? So yeah, we'll see.
The PTSD that I have once you allow the states to regulate is like, I think AI therapy is a good example. You had Slingshot that was active in 50 states, I think, and then in Illinois, I don't know how to pronounce American states. Like then they banned it, then that was not available in that state, and then there was like a new executive. Then and like as a company, it becomes extremely difficult to take all of these regulation nuances into account. And like I think from a federal perspective, the way like if America wants to win the race from an AI perspective, I think that's the only way to impose it on a federal level. Otherwise, like I think we will get behind relatively quickly. Are there arguments to make to regulate it on a state level? Yeah, plenty. But for now, I'm a big fan of the federal regulations, to be fair. And also, again, I'm a European. Like I'm used to dealing with way too many regulations, and Europe comes up with new regulations every single month about like, hey, we're now going to do this, then we're gonna do that. And we have like a very big team internally, and the only thing that they need to do is read through European documents where they make decisions, and then 2 days before they will impose a decision, revert the decision and give us more time. And like whatever America can do to prevent this type of red taping bullshitting, I think would be very welcome, to be honest.
Yeah, I counter argue that I think it seems like on paper, yes, like states, they look like European countries, and so Europe has this negative example of countries usually killing something at the country level. I don't know. I think there's a lot of history that suggests that states are doing it more efficiently than the U.S. government. There are many rules, but at the same time, they're also typically more embedded with the community. They're not some kind of like ambiguous government body in Washington. They're like usually like people who are right there in the community. So it's, from what I hear, it's like easier to talk to them, easier kind of figure out what has to be implemented, what's not. When you do that at the federal level, it often becomes this political weapon, especially when you do it through like executive order. The new guy comes in, changes the executive order, does something of their own. I'm just afraid it could be like a political game. And as I mentioned, with the big company, you saw that inauguration picture. All of a sudden they all showed up. All of a sudden they have all these lobbyists. So I don't know. It's interesting. My concern is that it's going to be played as a sort of political weapon. And maybe in some of the examples, some of those big companies, because they're so close to DC, all of a sudden they have some kind of exemptions, or because they're kind of like helping the U.S. economy so much, all of a sudden they're this players who are become like really important to the economy. That's why we need to give them exemptions. It's like, for example, Trump's favorite play on tariffs. Like if you come talk to him, all of a sudden he's like, oh yeah, you know what, we're gonna forgive you on that, or something like that. So I don't want games like that. I want a sort of very transparent, very kind of known to everybody regulation, and I think that's kind of the future. So yeah.
I'll just say, as an immigrant in the US, I faced so many weird things I never could expect might happen in the country. As an example, you have to change a driver's license every time you move from state to state. Like, I would never think that makes any sense. If I'm in one country, why my driver's license would not work forever in a different state? But that's the thing that bothers me, that there's some weird things that belongs to state regulations are actually weird. But on the other hand, my biggest fear with this is that the whole new administration's concept is deregulating everything. And some of the guardrails we talked about that needs to be in AI in healthcare in a previous episode, in mental health and other things, I think they're just gonna skip it and not regulate it at all. And that's why I was sort of excited when Illinois banned the AI therapy in some way, because I think the state was just looking like, hey, federal government is not doing anything in that regard, so we have to step up. So yeah, we'll see how this plays out, but definitely there are pros and cons for this, for sure.
I have a little bit of story about the driver's license. So yes, here's the paradox of life. You move to another state, you change your driver's license. If you rent in Europe, everybody welcomes my New York driver's license, no problem. Like, seriously, almost any country I've been in, Germany, Poland, Lithuania, yeah, New York, yeah, we know this driver's license, it's okay, go drive a car. So it's like so funny sometimes.
All right, gentlemen, let's get to our nominations of this year. Absolutely new concept, just as our news discussion. No one ever done this before. But yeah, let's start with the best company of 2025. Who wants to go first?
I can go first. I try to be original because there are some like usual suspects that you can pick. But I actually went for Heidi Health, which is surprise, a Scribe. And the reason that I went for them is because they are not talked about that much in the AI Scribe ecosystem. We mostly talk about Abridge and Ambience. They also only raised 100 million, while Abridge, I think, raised 700 million plus, Ambience raised 300 million plus. And they're from Australia. But even with all of these things, they ended up as number 6 on the OpenAI most used AI tools by physicians. And the main reason that I picked them is I met the founders a few times. I think they're extremely capable people, and they're actually the only AI Scribe that is taking a different approach, that is not like entirely focused on revenue cycle management, but they are like more on a product-led growth approach and also a more international approach. So like, for example, in Europe, we also need scribes, but we don't need them in some cases, at least. We don't need them for billing per se, but we need them because it makes our doctors more efficient. And like in the UK, they have a very strong product-led approach. Like a lot of UK physicians are actually using their technology. And they're doing that in other countries as well. And it's cool to see them winning in Europe, because I don't think there are many good AI scribes in Europe right now. My main question for 2026 to Heidi, in case they're listening, is like, will they also go through the pain of medical devices as well? Because, for example, within the NHS, the national director or whoever published a post saying like, hey, whenever you use an AI scribe, it needs to be at least a class 1 medical device. There is not a lot of like these big, like a bridge ambience. I don't think they bother going through medical devices. In the UK, you only have one, which is called Torches, I think, that is the class 1 medical device. But the question is, will others also join that? And I hope Heidi will, because of the regulatory mode, not because I believe it's needed, but because I think it will really position them well in Europe.
So you're talking about going through that in the US? About
No, in Europe. So you need to
Europe.
be a class 1 medical device as an AI scribe.
Say, in the US, nobody gives.
No, in the US, nobody cares. But even I was talking to a Portuguese hospital, and he was like, yeah, you need to be a class 2B medical device as an AI scribe. It's like, that makes zero sense. But imagine in like 3 years, Europe being Europe, like making it mandatory that scribes need to be class 2B. Like once the bridges and the ambience saturated the market, suddenly they need to go to 18 months of regulatory burden, and they will just lose. So like, I think whoever can capture that regulatory mode will actually have a very, very strong position going into 2026.
Yeah, I did that review of AI scribes. So I was actually kind of positive on Heidi back then when I did it.
You positive?
Yeah, I had a few positive stories there. Yeah.
All right, I'll go next. Sergei, you can think what's your best company of the year. Mine, surprisingly, probably for my friends, and I'll explain in a second why. My pick of the best company is Aura. I think it's a rare consumer wearable outlier. They made 1 billion revenues 2025, 11 billion valuation, really strong brand. The reason why my friends are going to be surprised because I actually have a competitor for Aura. So I had some bad experience communicating with them a while back ago. So that's why I went with a competitor. But overall, I'm super impressed of their brand positioning and how they actually were able to succeed in the space where there are not that many successful companies. So yeah, Aura is my pick for 2025.
You're going to be all surprised, guys. But the best company, and again, it's just based on numbers, not like anything else. Because I was looking at, in this case, public companies in health tech, because there's the most data. I don't trust private companies with their numbers, to be honest, because I've heard so many lies. But with public, you cannot lie, I guess. It's like a really great lie detector. So if you literally go there and just look at 2025, the best company for me is not even in human health, it's actually in animal health. It's called IDEX Laboratories. So IDEX Laboratories that nobody knows about because I guess it's animal health. But the lessons that we can see there, we can actually, I feel like, apply to human health because they're doing a lot of things right. First of all, they're not talking about any, well, right now they're not talking, obviously, but even before their IPO, which was a while ago, many years ago, actually, decades ago. So it's an old company. And so back then there were no just VC rounds. Everybody was just trying to be disciplined. So they're basically a bootstrap company, like almost didn't ask for external capital, definitely didn't do any of this bullshit, Series A, Series B, all this, freaking alphabet, you come back for more money. So when you're disciplined like that, I feel like that's kind of formula for success. They've developed their own diagnostic tests for animal health, like basically all sorts of stuff, like urine, blood. So I feel like maybe not like the technology, but certainly the kind of the winning formula can apply here. Start making Earnings, pretty early. Now, even if you look at like pure earnings, not even talking about revenues. So revenues are definitely in like tens billions, but profits isn't billions. So it's a $56 billion company, went up 72% this year. Would have been a great investment. I think there are not many close competitors, so that's maybe to their advantage in animal health. Again, not human health and animal health, but IDEX Laboratories. That's my company.
You're right. You did surprise us. All right, let's move on to the worst company of the year. I can go first. Actually, my pick is kind of boring. I think about 11, 12 years ago, I was managing a project, and that project basically belonged to this company. And I was so excited. I was telling everybody, oh, I'm basically working on a project for the company called Rite Aid. And like this is like the one of the biggest brands in pharmacy. Like everybody knows them, one of the biggest in the US. And I was so excited. But then now it's a second bankruptcy, lots of mass asset sales and closures, basically effective wind down. So this is a perfect example when how the company was not up to date with all the tech and innovation that happened in the space, and they did not change their business model and everything on time. So yeah, my pick of the worst company of 2025 is Rite Aid.
Mine is Don, the HDHD telehealth pill mill, where the founders were convicted for conspiracy to distribute controlled substances, and both of them are now facing the kids in prison. The main reason for that is like during the COVID boom, we had all of these pill mills that were doing those stupid TikTok ads where they say like, hey, you can get diagnosed with ADHD in 10 minutes, and then they would give you access to medication like it's nothing. And I think the fact that they are now, obviously they're a loser because they did that. And then second, the fact that they get convicted is a good signal to the industry. Like, don't fuck around in healthcare and get people on pills in like a get rich quick type of scheme.
Great pick. Sergey, what's yours?
Yeah, I'm gonna say, you know what, since I've written so much about it, I'm gonna say Hippocratic AI. But actually, honestly, like all Hemant companies, because there seems to be a theme of strange culture. You talk to the management, they all praise the company, but then you go a little bit down and it becomes much, much worse. The problem is, I believe, in leadership, because when you are promoting certain idea, which sounds great, but then you don't know what's happening inside your own company, what technology can do yet, but whether you actually know it or you don't know it because you don't talk to your team and you say it not knowingly. To me, it's kind of like both of those scenarios kind of show that leadership is not there, and the toxic culture within the companies is just not right in health tech.
I will add one caveat. Obviously, I'm extremely biased because Sword is a GC-backed company, but they do have some very cool companies in portfolio. I think one of them is, of course, Sword. The other one is, not sure if you ever heard about Prepared 911, Sergei or Alex. It's like essentially what they did is like AI scribing for emergency centers, and they also built like some AI agents for them as well. And they got acquired by Axon, the company that came up with the taser, for nearly $1 billion. And it's a very, very cool company, and that was also GC backed. So they do some very cool stuff as well. But I get the concerns for sure in some cases.
All right. Let's get to the person of 2025. Who do you think in healthcare or digital health is the person of this year?
I think Sergei will kill me, but I picked the founder of OpenEvidence, actually, Daniel Nuttler, mostly because like the way that he's playing the game is extremely smart. Like he clearly knows what to say and how to say to investors. And then again, the way that he built the team by just like hiring Doximity people and then just repeating the playbook that they already played and getting to insane amount of traction based on, again, the numbers that they share, which Sergei questions and I think we should all question. Like, if all of these numbers are correct and they're actually doing the things that they're doing, and probably they're cooking so many HR integrations and some of these things that I would expect, I think he's doing a very cool thing as a founder. And obviously he's making a lot of people very rich and himself as well, along the way as well. Yeah.
I'm gonna pick Hallie Taco for 2025, just because I've got to know her a little bit, at a kind of personal level, like what she's been doing, what she's been teaching. To me, education is really important in this industry. There's so much crap going on. So to be a person who dedicates time, talking to students, talking to the industry, without seeming kind of benefit to herself. I mean, every time I find somebody like that, I immediately kind of praise that person. And also, she let me on the preprint of her upcoming book. So I don't know, maybe it seems like I've been paid for commercials, but I can assure there's not. I like the book. I mean, just the message is a good message. We need to kind of make sure that technology is used for good. In her book, she actually mentioned some companies that I didn't realize, but there are quite a few companies in healthcare that have this dual mandate, basically make money for their shareholders, but make sure that the community also stays in good shape. Those are, I forget the exact name, but it's basically like some kind of benefit companies, as opposed to just C Corp, for example. That's your typical structure. So kind of educating us on healthcare and how technology can help. I think she's been doing, I think, well in 2025. So I wish there would be more people providing that kind of education, that kind of service to the industry.
By the way, fun fact: Elevate is a company like what you described. It's a public benefit corporation, PBC, yeah, exactly. And Elevate is one of them. And I'm also a big fan of that. And just FYI, a note about what I was saying about OpenEvidence. Like, indeed, you need to build a company where you can get your shareholders happy, but then also you have to have a net positive impact on society. And I think OpenEvidence is a good example that has a net positive impact on physician workflows. So that's, yeah.
Yeah, a lot of people actually in America saying it's a bit un-American, because this kind of goes against capitalism. Because I remember, because I was in the industry when this whole ESG industry started, environmental, social governance, yeah, which basically says, look, it's not only about money, it's also like whether you do good. And there was like so much criticism, and people are like on Wall Street, like what are we doing? Like our goal is to make money. Like, so it's kind of interesting topic. But I think for healthcare, they shouldn't. I don't know. There shouldn't be any. I feel like big criticism, because like you're dealing with lives of people, so it kind of makes sense to me.
All right, and as a spoiler, Hallie Taco is coming to our podcast early next year, so subscribe not to miss it. My pick for person 2025, and actually it took me a while to come up with someone, because it's hard to actually choose just one person. And after thinking for a little bit, and this person unfortunately did not send money to me yet for this pick, but my pick for 2025 is Sergei Polevikov, and I'll explain why. I think the reason for that is not because I'm his biggest fan of his style of writing or anything, but I feel like healthcare really needs transparency. And to be honest, sometimes I get sick of people who, like, in personal messages, can trash talk about some companies or some people, saying how terrible they are and how they do harm in healthcare, and then publicly they praise these people or companies, and because they might have a contract with them or something like that. I feel like we need more and more transparency, and investigations you do, Sergey, go viral. I think because there's a lack of transparency in this industry, and Rick, Ben, Brandon, and a few other folks, they do also a really great job sharing their opinions, pretty transparent opinions about what's happening. So I think we need more people like this in 2026.
Thank you. I didn't expect that. Oh, come on, man.
Well, I mean, I wouldn't mind if you Venmo me after this, but anyway, let's move on. Our biggest story or trend of 2025.
To me, when you are dealing with AI models, the biggest story was the fact that it kind of hits home when we're talking like general things about AI, but when it affects like people's lives. In this case, OpenAI has had several cases when people actually die from suicide, and now it's in this litigation mode to the extent that I don't know if you guys know, but when they moved from ChatGPT 4 to ChatGPT 5, they drastically cut all the medical advice from their model. So for certain things, it's still advising. For a lot of things, it's saying call your medical provider. I don't know if it's a good thing or not, but definitely, we're dealing with human lives, and that's kind of the scenario that a company as big as OpenAI has to change their models like drastically because of that. To me, that was a story of 2025 in healthcare.
Mine is going to be a really obvious one. I think the amount of hours spent on different podcasts talking about MBA AI was the biggest out of all. So I think the obvious one is MBA AI in 2025 is the main trend and was discussed more than anything other than in healthcare. So this is my pick of biggest trend in 2025. Rick, what's yours?
The biggest trend is the amount of people that are bullshitting executives in how good AI is and how easy it is to implement. Because it's so freaking easy to do a demo and wow anyone. And then when you go into the details of an actual implementation, it's so painful. And executives are so far away from the actual execution, and they think AI is magic and it will solve all their problems in a week, and it's not. So that's my biggest story. Too much snake oil and too much bullshitting, unfortunately.
Great choice. All right. Inspiration of 2025. What inspired you most this year? I can go first. And I'm sort of biased on this one. My inspiration of 2025 is healthcare providers in Ukraine. I feel like the work that people are doing, it's just incredible. Like people delivering babies in the basements because there's a missile attack, or obviously medical professionals who are on the front line helping wounded soldiers. These people never signed up for this. And I feel like the footages, and we'll show some of them, are just incredible. And this is my inspiration 2025. Right, Enrique, I know you got to jump off, so give us your inspiration 2025, and if you have a minute, your prediction for 2026 as well.
Yeah, I will be short because indeed I need to jump. But like my inspiration is essentially the builders out there that actually go deep into the weeds of the clinician and the admin workflows and actually try to build something meaningful and not try to build something that VCs want to see and that is like good from a demo perspective, which is extremely difficult, and I respect everyone in the game. And I think my main prediction for 2026, and then I will do like a mic drop and disappear. Obviously I'm biased, but I think voice AI agents, like voice in itself, will become the main patient interaction interface for patients, and it will exceed the human to non-clinical interaction. So what I'm saying is like, obviously the doctor patient, that will still be top human, but like all non-clinical things, I think will be like voice AI will be everywhere, and it will have a very cool impact on healthcare. And that's it for me. See you at the next episode. Thank you.
Happy holidays, Rick. Enjoy.
Ciao.
Right, Sergey, before we get to our prediction, we have a couple more categories I still want to go over. Deal of the year. I really did not really come up with something interesting. I feel like the deal between Microsoft and Epic announcing their partnership this August, I think it's probably the biggest one and the most discussed one. But yeah, what do you have?
So what I have is kind of interesting because it kind of like underlines my story that I've had for at least over a year, basically, and I've written about that. But let me say about the deal first. So Qualtrics, it's a consumer service software group, private equity owned, obviously, as many of them. They bought healthcare data and analytics company Press Ganey Forster for $6.75 billion, including debt, which, from my understanding, is the biggest deal in terms of numbers this year, unless I missed something. And I actually wasn't surprised because I've been telling all along that, and some people may disagree, but especially in healthcare, it becomes less and less about AI models and more about quality of data and also quality of your analytics. So I feel like, we talked about it last time, and I made a prediction that in 24 to 25 we're gonna have shaping up of the AI scribe market. But I feel like because U.S. healthcare is so screwed up and so fragmented, we didn't really have that. There's still a bunch of AI tourists, selling their product just because they found their little niche and like they haven't been out competed yet. But I think it's coming. So anywhere who thinks that they can just use AI model and kind of fine tune it and this is gonna be their business, I think it's unsustainable. But if you have a data set or you've been collecting data and you've been very structured and accurate about that, I think that's the future. And I know actually quite a few companies in healthcare who are doing that at a pretty high level, and I think that's the future. And this deal kind of underlines and completely emphasizes my story. And this is basically my prediction for 2026 that we're probably going to have more deals like that. Data is king. I think models are going to die off because it's like we already have enough AI model providers, and to claim that you're going to be better than OpenAI, it's going to be very difficult proposition as all of them improve their models. So yeah, actually 2025, just to finish my thought, in my opinion, was a year of M&A in healthcare. We've had so many deals that by some measures we actually outshined 2021, which was the record breaker by all measures, like for a while. And this year was even better. So it's there's some hope. I think things are moving in certain directions. My concern is that even with those deals, most companies are unprofitable. They have to figure out how to make those earnings. But yeah, things are moving. I think this is good news, and we'll see what happens. But to me, companies who are good with their data, I feel like it's going to be story of 2026 and beyond.
All right. Before I give my prediction for 2026, we still have one more category: the loser of 2025. Who's your loser, Sergei?
To me, the biggest loser of 2025 is a customer of 23andMe. So 23andMe, this DNA collection company that have been praised for many years. A lot of us believed the founders, the story. I've been skeptical since actually 2018 when they started doing some shady deals with third parties. I started questioning, whether they're selling the customer data. Until this year, pretty much, they've been denying that until the bankruptcy and all the filings revealed that indeed they were selling customer data. And so immediately, I think even some of the government agencies were advising customers to use the delete option on 23andMe platform. I'm not sure if that actually works, that you can just wipe up. By this time, they've probably sold and resold, which to me was such a tragic story, because it's been the darling of the industry for so many years. and it's just awful. So they announced bankruptcy. They're still trying to revive something. I think somebody's trying to buy what remains of the company. I think obviously, as I've been saying, data is very valuable, but the point is nobody gave a permit, none of us consumers, to sell our data. Like that was part of the story. And so the way they betray their customers, it's such a blow to the whole industry. And I think a lot of sort of everyday consumers are now questioning basically any technology, like here in this story. So to me, it was such a tragedy and such a losing story for the industry of 2025.
Great pick for sure. My loser for 2025, I think the main loser is science. I feel like everything was happening, especially in terms of healthcare, when people are just starting questioning every single thing, and evidence-based medicine is not a final reason to make a decision anymore. I think it's not leading us in the right direction. And I literally know stories when people don't talk to each other like sisters and brothers because someone wants their children to be vaccinated, someone don't, and it just going crazy. And I feel like all the cuts on budgets on research happening as well is not taking this country in the right direction and the society overall. And if we're talking about the US specifically, there are literally lots of researchers are leaving this country and getting grants from governments of other countries, and some of them are actually what are called main competitors for the US. I think this is a big failure, and science is the loser of 2025, in my opinion. Prediction for 2026, mine is actually kind of pessimistic. My prediction is that in 2026, there is going to be a huge data breach in one of the big healthcare companies. I think security is something we still don't talk as much as needed. And data breaches and leaks happening all the time. But I feel like next year there's going to be a huge scandal because one of the big players in the company is going to have a huge data breach, and it's going to raise a lot of questions, and the whole concept of security is going to change. But that's what I think is going to happen. But yeah, trying to end the episode on the more optimistic note, Sergey, wish us something for the holiday season.
I here actually in Lithuania with my family for the exact reason that sometimes we have to put things in perspective. We're have a goal, whether it's career goal or whatever. I feel like sometimes we have to step back and see what's important to our lives. So like, it's the holidays, so try to remember your parents, your grandparents, family. To me is like so important, and holidays emphasize that. So like, I don't know, a lot of people saying that, but it's kind of true that make sure that you know your neighbors, who is lonely, who is not. Try to cheer up. It's so important, for mental health, to just for life in general, to be with your family, be with your friends, cheer up. Whoever is in a bad mood, or if something, God forbid, happened to that person, be helpful, be cheerful, stay positive.
That's a good one. I'd say that kind of following up on Rick's biggest story of the year about so many executives bullshitting about what they do, about numbers. And I know a lot of early stage startup founders are watching our episodes. I want to wish you guys to obviously reach success in the industry. We need a lot of really cool executives and founders in this space. Please don't bullshit anyone with your demos and numbers. If you're not sure that this is actually going to be implemented and integrated in the workflow of a healthcare system or whatever you're doing, just switch to something else or pivot. Don't try to trick anyone. This is the industry where we need transparency, as I mentioned before. So I wish you best of luck. Stay strong. It's definitely a marathon, not a sprint, especially in healthcare. But you can do it, and there are so many success stories out there. So just just be transparent and hopeful. So happy holidays. Again, please subscribe to our channel. That's our first year, first holidays for Digital Health Inside Out. I think we have a lot of new formats planned for 2026. Lots of new episodes and topics we need to discuss for sure. But yeah, looking optimistic and excited about what's next.